Thank you for choosing ChristianaCare for your spine surgery needs. You play an important role in your recovery. We include you in your care every step of the way and encourage you to ask questions throughout your surgery journey.
Your spine care team will work together to care for you. Let's review who will be on your care team so you know what to expect when you're in the hospital. The surgeon will complete the surgery. The physician assistant will help the surgeon in the operating room, order your medicine for you, and continue to check on you in the hospital. They'll do this with the help of the nurse practitioner. The nurses will check on you often throughout your stay. They'll be checking your strength after surgery and will also check and listen to your belly, your heart, and lung sounds to make sure that you are healing well. The patient care technicians will help you with your day-to-day activities, like bathing, getting dressed, and going to the bathroom. They will also check your blood pressure and temperature. The physical therapy and occupational therapy team can help you move better and get back to your normal routine through exercise and the use of assistive equipment if you need it. If you are walking around without any trouble the night of surgery, you may not need these services. The case managers will visit during your stay to help make sure you have what you need when you leave the hospital. They can set up services for you at home like physical therapy or nursing care, as well as help get any of the equipment you may need, like a walker or a commode. They can also help get you placed into a rehab facility if you and your care team decide that's the safest option for you.
There are some steps you will need to take before surgery to set yourself up for a successful recovery. It's important to get your home ready before you go to surgery. That way it's safe when you leave the hospital. If no one is at home to help you, be sure to prepare meals that you can freeze before you come into the hospital, so you won't have to cook when you get home. It might take a few days to get used to being back at home. If possible, have someone stay with you the first few days after surgery. You will also want to move anything out of the way that could put you at risk to fall. Pick up throw rugs, remove wires and cords, and keep the floor clear. Have secure handrails in areas where you will need to hold on to, like the shower. If your doctor has ordered a bone growth stimulator, make sure to set that up before your surgery. Your doctor and someone from the bone growth stimulator company will have a conversation to set it up with you. You also can get equipment that may help you at home when you're healing, like a shower chair, a bedside commode, and a raised toilet seat. These are generally not covered by insurance, but you can buy them ahead of time so they are ready for you when you get home. You will have some testing that needs to be completed before your surgery. If you are diabetic, they will do a test called an A1C to check your blood sugar. This is because high blood sugar can make it harder for your body to heal. You may have to be checked for an infection called MRSA. If you do have MRSA, we will have to take extra steps on the day of your surgery to prevent infection. Make sure your testing is done and your doctors have had the time to read the results and make sure you are safe for your surgery before your actual surgery day. A nurse will call you a few weeks before your surgery. On this call, the nurse will review your medical and surgical history, medicines you take, and your allergies. They will let you know what medicines to take on the morning of surgery. You do not need to bring your medicines with you to surgery, so please plan on leaving them at home unless someone tells you to do otherwise. A special soap will be mailed to you within 10 days of your surgery. The soap should be used each day during showers for 5 days before your surgery. If you do not get the soap in the mail, please call your doctor. I'm sure you're wondering about that special soap. Using the special soap will help stop infection after surgery. You will need to use it each day during showers for 5 days before your surgery. If you are allergic to chlorhexidine gluconate or CHG, do not use this soap. Instead, use a soap that helps fight bacteria like Dial, Safeguard, or Lever. Follow these steps each day during showers for the 5 days before your surgery, including the night before. Wash your hair as you normally would and then rinse your hair and your body fully. Turn the water off after you finish washing your hair to stop the soap from washing off too soon. Put the soap from your chin down using a clean washcloth, or you can use your hands. Do not use the soap near your eyes, ears, nose, or mouth. Wash your front and back, including your arms and legs, for 5 minutes. Clean the area where you are having surgery extra carefully, but don't scrub too hard. Do not wash with regular soap after using your special soap. Turn the water back on and rinse your body well. On the night before your surgery, there's a few things you need to do to prepare. Put clean sheets, blankets, and pillowcases on your bed. Take a shower and use a clean towel to dry off. Do not use creams or lotions on your stomach or back. Now let's talk about what you can expect on the day of your surgery. When you get up in the morning on the day of your surgery, do not shower or bathe. Instead, when you wake up, just get dressed in clean clothes. You should not have to bring in your medicine with you, but if for some reason you do need them, bring them in their original bottle so they can go through our safety check. You should get a call the afternoon before your surgery with what time you should arrive. If your surgery is on a Monday, you'll get a call on the Friday before. When you come in, park in the parking garage and come in through the main entrance. Let the front desk know you're here for surgery and they'll direct you back to the suite, B115. You can usually have one support person with you when you check in. Your care team will make sure everything you went over on the phone is correct in the computer. All the information is checked for your safety. You will go back to the area where you get your surgery after that is completed. This is when your family member or support person will go to the surgical waiting area. When your family gets to the surgical waiting area, they should check in with the volunteer using your name. They'll show your family the electronic board where they'll assign a number to your name. The other side of the board will show your location, such as the prep and holding area, the OR, or your recovery room, and a room number for after surgery may show on the board before you are in the room. You'll be here for about 2 hours before surgery, then the length of your surgery time, and then 2 hours in the recovery room after your surgery before you go to your hospital room. Please let your family know to wait in the surgical waiting area, and the surgeon will come out and talk to them about how things went and answer any questions they have after your surgery. If your doctor has talked to you about wearing a neck collar or back brace to help your body heal after surgery, be sure to bring it with you to the hospital on the day of your surgery. It is important to have this in the hospital room with you, so your care team can help you with moving after surgery. Talk to your support person about making sure the brace and or collar make it to your hospital room.
After surgery, you will be moved to a nursing unit. If you are going home the same day or the next day, you'll go to the surgical admission unit. If not, you'll go to 7E. This is on the 7th floor of the Heart and Vascular building. Once you get to your nursing unit, your nurse and patient care technician will help get you settled and check on you to make sure you are recovering well from surgery. We will put boots called pneumatic compression boots on your calves. These help prevent blood clots after surgery. Sometimes after surgery, there is a certain amount of time you have to wait before you can get up. As soon as you're able, your care team will help you get out of bed to start moving around. This can also help prevent blood clots. You'll probably feel hungry after surgery. To make sure you're safe to eat right after surgery, we start by giving you some ice chips to try. If you feel okay with the ice chips, we'll give you clear liquids, like water or apple juice. If your belly still feels okay and you are not nauseated after the clear liquids, you can start eating the foods that your doctor has ordered for you. There are some food options for your visitors as well, located in the main lobby. There is Au Bon Pas, a restaurant, and a Brouhaha Cafe. When walking into the main lobby, there is a cafeteria down the hall to the right. And to the left of the main lobby, there is a Brouhaha Cafe located in the Heart and Vascular lobby. There is also a chapel located to the right of the main lobby. Please let a member of your care team know if you have any spiritual or cultural needs while you are here in the hospital.
It is very important to cough and deep breathe after surgery. This helps prevent infections like pneumonia and fevers. We will also give you something called an incentive spirometer, pictured here. This is a machine that helps you take deep breaths. Your nurse or the respiratory therapist will help you learn how to use it. Try to use it at least 10 times an hour while you are awake. Many patients will have drains put in after their surgery. This will drain extra fluid the surgeon doesn't want sitting around your incision. The nurses will measure how much is coming out of the drain and the doctor will decide when it is best to remove it. It should be taken out before you are safe to go home. If you are going to be in the operating room longer than 5 to 6 hours, the nurses in the operating room may put a catheter to drain your bladder while you are sleeping. The catheters are usually taken out before you wake up from surgery, but sometimes they are left in for a various reason. Removing the catheter as soon as possible helps prevent infections. It is common to have trouble urinating or peeing after this type of surgery. The nurses can use an ultrasound machine called a bladder scanner to see how much urine you have in your bladder. This test is quick and painless. If there is too much urine in your bladder, your nurse will have to empty your bladder by inserting a catheter. This allows your bladder to empty, and immediately we remove the catheter once you're done. They will check the amount in your bladder about every 6 hours if you're having trouble going, and give you the opportunity to try to go on your own. Your doctor may have already discussed what type of pain control you're going to need after surgery. While you're in the recovery room, the nurses will give you IV medicine. This is medicine that goes through a tube in your vein. They may connect you to an IV pump. We call that a PCA. It stands for patient-controlled analgesia, which really just means that you, the patient, get to control your own pain medicine. It's helpful because you're able to give yourself a small amount of pain medicine every 10 to 15 minutes by pushing a button. This medicine works quickly, but it doesn't last long. If this is what your doctor has chosen for you, they may prefer to leave it on for a day or two. Your doctor may also decide to use an on-cue ball. This is a ball connected to you with numbing medicine inside. If you have an on-cue ball, you'll have a black bag with a heavy ball to carry around with you. This comes out before you go home and doesn't take the place of any other options for pain control. The goal is to start taking pain medicine by mouth as soon as possible. It can also be very helpful to try other methods of pain management, like using ice packs. Please be honest with your doctor about how you're taking your pain medicine before surgery. That way they'll know how to better manage your pain after surgery. Now let's talk about what it'll look like in order for you to go home. There are some things that your care team looks for to know that you are safe to go home. Before you go home, it's important that you can use the bathroom on your own. Manage your pain with medicines you take by mouth, walk safely, and eat and drink normally. It's common to be able to go home the morning after your surgery. Please have your ride home scheduled. That way you aren't waiting too long. There is a pharmacy in our main lobby where it's convenient to get any prescription you may have filled before you even leave. The case manager will set you up with any new equipment you need at home. Your physical therapist will make sure you know how to put on your brace, if you have one, and review other safety tips with you, like how to get in and out of the car and how to be safe at home.
There is a discharge lounge between the main lobby and the heart and vascular lobby. This is what we call the final level of care before going home. Once the nurse has reviewed your discharge instructions with you, you will be taken to the discharge lounge to wait for your ride home.
When you do get home, it's important to take something for constipation. Surgery and pain medicine can make constipation worse. There are many over-the-counter medicines that can help. Make sure you start them right away. They may even be started while you're still in the hospital. After surgery, you should not do any bending, lifting, or twisting. The weight limit for lifting is usually no more than 5 to 8 pounds. Your provider will let you know when it's safe for you to start therapy. After your provider gives you the okay, start right away. We want you to know your medicines and their side effects, especially when you get home. It will help you stay safe. The nurses will talk about them with you while you're in the hospital, so you'll know what to look out for and what to do if you have any side effects. If your provider orders both a pain medicine and a muscle relaxer, do not take them at the same time. Both of those types of medicine can make you dizzy and sleepy and can be very dangerous when taken together. Our beds here at the hospital sit up, but yours at home may not, so you have to learn how to get into and out of it safely. The best way to get out of bed is using a log roll. To log roll, you'll first bend your knees and then roll onto your side, like the picture here. Next, you'll push yourself up in a sitting position and then slowly and carefully stand up. Believe it or not, washing your hands is the most important thing you can do to help lower your chances of an infection. Wash your hands before and after changing your bandage to keep your incision clean. We understand that this is a lot of information. It's normal to have questions. Please call your doctor if you have any questions about what to expect before, during, or after your surgery. Thank you for choosing ChristianaCare, and we look forward to helping you through your surgery care.